abducted. So we go dorsiflexion, inversion, external rotation at the hip, adduction, hip flexion. Okay? And this is normal. She's not going to go much further than this because her hamstrings are tight. Okay? So, first thing we do, this is our, what's this called that I'm having her do right now? But what am I doing when I'm walking her through this?
Do you want...
Rhythmic initiation. Okay? So I'm getting her familiar with it and myself. Okay? So, now what I'm going to have you do, you're going to go ahead and pull up, and you're going to pull right to here. The hand placement on this. Textbook will show having the hand placement on the top, right here. So as you go ahead and pull up, Lindsay. That was right, Lindsay. Mm-hmm. So as you pull the distal hand right here, go ahead and pull up. It locks in. For myself, this always bothers my wrist because I don't have quite the wrist range of motion. If you want to do it this way, as long as you have your manual contact in the appropriate place and it's on the top of the foot, this would be all right also. Go ahead and pull up. And you're doing this rotary component. I'll go easier. Okay, go ahead and pull up. With this also, if they're going to do visual tracking, make sure when they come up, now their head drops back down. Otherwise, she's going to be sore in her neck. Now as she comes back down, okay, then her head drops back down. Okay? Go ahead and pull. So we start distal, and then we go proximal. So now I'm truly going proximal. Go ahead and distal, go proximal. Distal, the proximal, and you can see that I'm staying right in that pattern. Now if we're going to go the opposite direction, we're going to do our D1 hip extension. We're in our starting position, so we go plantar flexion, eversion, internal rotation at the hip, hip abduction extension. And we stay here. Here's this grip that we use for the shoulder, right? It feels awkward when you're starting off here, but as soon as she comes down, all of a sudden it falls right into your hand. Go ahead and push. There we go. So what muscle group are we working here?
Hamstrings.
Okay, hamstring and
Glute.
Okay. All right, so that's with the knee extended. Are there questions? No?
I don't know.
So if we're going to do questions?
So when her foot is coming back, when her legs come back down, it's okay that she's still inverted? Because you started off inverted, right? Here.
Here,
yeah.
we start off everted here.
Okay.
So she goes into inversion here, and this is where we're finishing. So now we go plantar flexion, eversion, internal rotation.
But that's inversion, right?
No, this is eversion.
Oh, okay. Just look.
Are you testing me?
No, I was asking.
I think this is, all right. So if we're going to do with the knee flexed, what I'm going to ask you to do is so on the one that we just did here for our hip flexion, you felt that in your quad and probably your hip. With the knee bent, now you tell us what you feel. So what I'm going to do, you're still same starting position. We go, but what I'm going to have you do, Lindsay, is you're going to start here, you're going to pull right to here, okay? So manual contact, my hand is really important. If I have my hand right here on the top, Lindsay's going to just pull straight up because that's the cue that I'm giving her. But now that she knows where my hand's going to be, go ahead and just pull into my hand, wherever it is, pull, pull, pull. So true that we're going to get pulled up. There we go, pull up. So we could do it with one hand, but as we start coming up, it goes from distal to proximal. Go ahead and pull. Get that foot pulled all the way up. There we go. And I'm staying in the pattern. And now where do you feel this one, Lizzie?
Right, up here is my quad.
And your quad still, not in your butt?
I'm very quad dominant.
Okay, very quad dominant. This one should be a external rotator. So for her, I could take out my hand here, where she's not using her hip flexor as much, and just use this hand. So I want you to pull up here and then pull straight in. Pull straight in. And then it ends up switching because as soon as I put my hand here, she's wanting to use hip flexor. If I take that away where she's just pulling, this has to be adductors and external rotators. Okay? So switching this, now we would go plantar flexion, eversion, knees going into extension, hip internal rotation, abduction extension. And this one's going to be more for the glutes. Okay? For you in here practicing, I think this is a good one for you to practice with the knee bent in here, just because if you're a little bit shorter, it's easier to do this than getting all the way up here. Okay? What other one are we doing?
D2.
Okay, so D2 flexion. D2 flexion, here we go, starting position. Starting position is adducted. She's in inversion plantar flexion, so now it's going to go toe extension, dorsiflexion, eversion. Internal, we're going to keep the knee straight on this one starting. So internal rotation at the hip, hip abduction, flexion. So go ahead and first thing, extend. And on this one, this is the only one that where you keep the hand the same place instead of turning it over here, because no patient's going to go far enough where you actually get the resistance, so you can keep it here. But I'm still in the diagonal, okay? And our verbal cues on this one is going to be push, okay? Push, 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 and push, okay. And then she starts to get tired. This next one that we're going to do is going to be D2 extension with the knee extended. This is the one that I really highly recommend that you're cautious on. This is the only one that you're not pushing, you're not controlling with your body. Now they're pulling you. My first semester teaching, went through all this, and then I had a patient, she's 5'1", 5'2", gets up, the guy goes ahead and pulls and threw her right over the table. So, make sure, I tell this because like I'd never thought about it, but until I saw it, all of a sudden pull hard, go ahead and pull down. And for the female patient or student, it threw her right over the table. So this one, make sure that you're braced and you're ready to go through the pattern when you have them start. If you're the patient, don't try to throw your partner over the table. Okay, so our starting position is in dorsiflexion eversion. So here we're gonna go first thing, plantar flexion, inversion. Then we're going hip extension, right? Adduction, external rotation. We take them back up, go ahead and... So we still start with our resistance distal, then it goes proximal, and then I can have it. Go. And on this one, we give you internal rotation. Internal rotation. Perfect. Do you guys see that? The body position is really important with doing any kind of PNF, manual therapy. You want to make sure that you preserve your own body if you're going to do this for a while, otherwise you're going to get hurt. Okay? So what about if we're going to do this way with the knee flexed? So knee flexed, what we're going to do, starting position for a D2 hip flexion, knee flexed, still go into dorsiflexion, eversion. Now it's just coming straight out here and she's a little bit tight. Go ahead and push up. There we go. But here, it's really important where our hand is, right? If my hand's straight on the top, it confuses Lindsay on where to push because there's no resistance. If I put my hand here, go ahead and push. So you're just going to tell your patient push right into your hand. Okay. So now we're at the starting position for our D2 hip extension with knee flexed. So we go from here, we go plantar flexion, inversion. We're going into hip extension, right? And knee extension, adduction. Go ahead and push. 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 Are there questions on this?
Are you going into external rotation?
On what part? On the extension, you are going into external rotation slightly, but it's not much right here because on here we're working more of the glute. Actually, on this when we start off, we're still working quad. Myself personally, I don't use this one. I'm not as comfortable doing it. But this pattern, you're still going to go. It's external rotation of the hip.
Would you focus more on external rotation with a straight leg?
Right.
Okay.
Because that's the rotary component. Here we're already getting this because we're out here and we're in internal rotation. As she pushes, she has to go into external rotation, but it's not significant external rotation. As with the leg straight, when we come up here, so she's in internal rotation, she pulls down, this is definitely going into external rotation of the hip.
Are you really resisting with your Boston